A warm greeting to all. I am ARCHITHA of grade 7 and I am here to lecture on my political chapter 2, the role of government in health. And how the state of government works, do we all know that? As the Parliament of India is this. Then, table of contents. What are we going to learn? And what is healthcare in India? Public and private healthcare service. What is public healthcare service? What is private healthcare service? Healthcare and equality. The Kerala experience, the Coastal Rica approach. Then, what is health? In a democracy, people expect the government to work for their welfare. This could be through the provisions of education, health, employment, housing, or developments of road, electricity, and etc. What is health? Health means the ability to remain free of illness and injuries. But health isn't it only about disease. Then, what is health? Health, we know about it. Free from illness, physically fit, mentally fit, and also socially fit. Then, what is health apart from injuries and illness? Apart from disease, there are other factors too that can affect our health. That is also correct. They are polluting our environment. For example, if we drink clean water or we live in a pollution-free environment, then we are not prone to illness. Yes, that is correct. Then we will be physically fit, mentally fit, free from illness and also socially fit. If we don't get sufficient food, we will be more prone to sickness. That is also correct. If we don't get food, we will be getting more pains like stomach pain and also fever. Then, healthcare in India, compare and contrast. And now I am going to explain you of both the columns, and now you need to decide in which column that should be public healthcare and which is private healthcare system. In India, there are large number of medical colleges that we know. Among all the producers of doctors, we have the large number of producing doctors. And approximately there are 30,000 of new doctors qualified every year. And next, healthcare facilities have grown substantially over the year in 1950s, where there were only 2,717 government hospitals in 1950s. In 1991, they were increased in number. They were 11,174. And next, the count was 2000. In 2017, they were more grew, and they were 23,583. Then, India gets a large number of medical tourists. What is medical tourist? When a foreigner comes to our India to for his medical or her medical issues, we have a more number of facilities in India, and according to their own countries here, the price are low. They came for treatment in some of the hospitals in India that compare the best in the world. The third largest producer of medicines in the world is also a large exporter of medicine. India has India is the third largest producers of medicine. Then, most doctors settle in urban areas. Yes, that is true. People in rural areas have the travel long distance to reach the doctor. They may suffer in many ways. The number of doctors with respect to pollution there are much less in rural areas. What is rural area? It's a village area. An urban area is a city or town. About 5 lakhs died in the tuberculosis every year. Tuberculosis is nothing but a disease which affects human the most. This number is almost unchanged since independence. Almost 2 million cases of malaria are reported every year, and the number isn't a decrease. Of tuberculosis is a disease. Now it is not even, the number is not even coming down. It's still 5 lakh. You need to do that. It needs to decrease, not increase. Then we are not able to provide clean drinking water to all. 21% of all communicable diseases are waterborne. For example, diarrhea, worms, etc. Then, communicable diseases comes from our food, water, air, and etc. Half of all children in India do not get adequate food and are not undernourished. And half of the children are not getting sufficient food to eat, and they are not properly doing their things. Then, in order to prevent these illness, we need appropriate health care facilities such as healthcare center, hospitals, laboratories for testing, ambulance services, blood bank, etc. that can provide the required care and services that patients need in rural areas. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals. What is professionals? They are with that profession is known as, they are more known to that profession is known as the professional who can advise, diagnose and help treatment. We also need medicine and equipments that are necessary for treating patients. These facilities are required to take care of us. What is equipment? A tool used for a particular purpose. Then, healthcare in India. India has a large number of doctors, clinics and hospitals. The country also has considerable experience and knowledge in running the public healthcare system. This is a system of hospitals and health centers run by the government. It has the ability to look after the health of large section of pollution scattered over the hundreds of years in village. Hundreds and thousands of years. Moreover, there has been a phenomenal advancement in medical sciences whereby many new technologies and treatment procedures are available in the country. Our country has the money, knowledge and people that cannot make the necessary health care available to all. Yes, this is the true. So please help rural people and build them hospitals. Then, what is this? The story of Hakim-Sek. Hakim-Sek is a member of Baskin-Banga-Ki, as Mazador Samata, PBKMS is the full form of this. We need to expand this is nothing but Baskin-Banga-K, Mazador Samati, an organization of agriculture laborers in West Bengal who accidentally fell into running train and suffered head injuries and need immediate treatment. He spent 14 hours in a critical state while moving from hospital to hospital in searching of treatment. He was admitted in private hospitals where he had spent a lot of money. And he upset over in the different attitudes of the hospitals that refused to admit him. Hakim-Sek and PBKMS filed a case in the court. And we also need the medicines and equipments that are necessary for the treatments of patients. These facilities and requirement to take care of them. India has a large number of doctors, clinics and hospitals. The country also has considerable experience and knowledge in the running public healthcare system. Then, types of healthcare services. First one is public and second one is private. Now, what is public healthcare system? It has the ability to look after a large section of pollution scattered over hundreds of thousands of villages. Moreover, there has been a phenomenal advancement in medical science whereby many new technologies and treatment procedures are available in the countries of public healthcare services. Then, private? What is the full form of RMP? Registered Medical Practitioners. Then, our earth should be like this. A disease-free environment. The resource need to run these services are obtained from the money that we spend to public, paid to the government taxes. Hence, such facilities are meant for everyone. Only one of the most important aspect of the public healthcare system is meant to provide equality healthcare services either for free or low cost, so even poor people can take treatment. Another important function of public health care is to take action to prevent the spread of disease such as TB, malaria, diarrhea, dengue and chikungunya, etc. This has to be organized by the government, the participation of people, otherwise it is not effective. For example, when taking up to see the mosquitoes to do breed. What is breed? A type. In the water coolers, rooftop, etc. This has been done This has been done in all houses and every areas. And recall the Sikkim House. The story was really nice, but we need to take a severe action on that. Right? What is the difference between public healthcare and private healthcare? In public healthcare, these are run by the public sectors. In private healthcare, these are run by an individual or a private company. Objectives of these are low cost and subsided. And objectives of private healthcare are profit. And in the public healthcare system, these are in public healthcare system, these are very easy, but they need to stand in a long queue to get the treatment. That is so tough. And also there is a story, that is a rich child, how he go to the private hospital, and does his treatments, and a poor child of in a virus fever, suffering from a virus fever, goes to a poor hospital, goes to the public hospital. A poor boy stood in a long queue to accommodate